Hello guys, I think you will be fine and having a good health. Today's my topic is appendicitis. Appendicitis is an inflammation of your appendix and it is the most common cause of acute abdominal pain requiring surgery. Untreated, it can lead to serious complications such as peritonitis or an abscess. As far as symptoms and causes are concerned, appendicitis symptoms include abdominal pain, lack of appetite, vomiting, constipation or diarrhea. See a doctor or go to emergency room right away if you think you or your child has appendicitis. Quick treatment prevents most complications. And what is the diagnosis? How to diagnose it? To diagnose the appendicitis, a doctor reviews your symptoms and medical history, performs a physical exam and may order urine analysis, blood tests or a pregnancy test, imaging tests such as abdominal ultrasound, CT scan and MRI scan, which can help confirm an appendicitis diagnosis or show other causes of your abdominal pain. As far as concerned about the treatment, doctors typically treat appendicitis with antibiotics and with surgery to remove the appendix, either by laparoscopic surgery or a laparotomy. Prompt surgery decreases your chances of a burst appendix. Doctors use a special care for treating a burst appendix, abscess or peritonitis. Some mild cases of appendicitis may be treated with antibiotic alone. The digestive system is made up of gastrointestinal tract, also called the digestive tract, and liver, pancreas and gallbladder. The GI tract is a series of hollow organs joined in a long twisting tube from the mouth to the anus. Appendicitis is inflammation of your appendix, a finger-like pouch attached to your large intestine. The appendix is in the lower right area of your abdomen or belly. In the United States, appendicitis is the most common cause of acute abdominal pain for which you need surgery. About 5 to 9 of every 100 people develop appendicitis at some point. Appendicitis is slightly more common among males than females. It happens more often in people in their teens and 20s, but it may happen in people of any age, including older adults. And what are the complications of appendicitis? Untreated appendicitis can cause your appendix to burst. A burst appendix could lead to complications. One such complication is peritonitis, which is a serious infection that can spread in your abdomen. Another possible complication is an abscess of the appendix called an appendiceal abscess. The most common symptoms of appendicitis in pain in your abdomen or belly are as following: benign near your belly button and move lower and to your right. Start suddenly and may even wake you if you are sleeping. Get worse when you move around. Take deep breaths, cough or a sneeze. Be severe and may feel different than any pain you have ever felt. Happen before other symptoms and worsen in a matter of hours. The symptoms of appendicitis may include loss of appetite, nausea, vomiting, fever, swelling in your abdomen. However, some people who are found to have appendicitis, especially children, may not have any of these typical symptoms. Talk with your doctor right away if you or your child are experiencing any pain or discomfort in abdomen. A doctor can evaluate the symptoms you or your child are experiencing and provide a diagnosis and determine other possible reasons for complications. Some people with appendicitis may also have bowel symptoms, problems such as an inability to pass gas, constipation or diarrhea, the feeling that having a bowel movement will relieve discomfort. What is the cause of appendicitis? Appendicitis can have more than one cause. In many cases, the cause is not clear. Possible causes include hardened stools or growths that can block the opening inside the appendix, enlarged tissues in the wall of your appendix caused by infection in the digestive tract or somewhere else in your body, inflammatory bowel disease. Appendicitis is a medical emergency that requires immediate care. See a doctor or go to the surgeon in the emergency room right away if you think you or your child has appendicitis. A doctor can help to treat appendicitis, reduce symptoms, and lower the chances of complications. Thank you for listening my video, and don't forget to subscribe my channel. Thank you very much. Have a wonderful day.